Our next speaker was once referred to by a head of state, we're talking like a national leader, as the good doctor. And it's true, I've seen it. And I do believe President Obama also said, I can't pronounce your name. And that's why he referred to you like that from then on. So with that, everyone, please welcome to the stage the good doctor, Abhijit.
So I'm going to talk today about health data that is available relatively freely and relatively copiously around the world through open data initiatives with various governments. So first of all, many of you may not know who I am. Yes, that little tidbit, I had an opportunity to be on TV with President Obama about 5 years ago. But that's the limits of my claim to fame. So I'm just going to introduce myself a little bit. I'm a local here in DC. I know this is no longer our data, it's no longer our conference DC, but nonetheless. I co-founded Stats Programming DC with Mark Weissman, who you guys heard yesterday. I've been using R for God knows how long, over 20 years. I think my first version was like 0.3 or something like that. And I'm an occasional blogger. Work-wise, I've got my hands in a few pies. I'm do data science at a startup locally across the river from DC in Arlington, Virginia. But I also, for most of my time right now, do biostatistics and machine learning, currently at AstraZeneca. And no, I do not know anything about the vaccine. And I was at NIH for a decade doing sort of the same stuff. I also teach R, again with Mark. We tend to do a few things together over the last 10 years at Georgetown. And I'm also adjunct at George Mason, which are two universities that are relatively known. And I teach R and Python both in the university setting as well as for corporate trainings and the like. So stay busy in terms of both learning R, teaching R, using R. I'm not quite as fanatic as Jared, I think, but I'm probably pretty close. Because I actually still also use Python. So Jared still. So why am I talking about open data in healthcare? Well, I've been interested for a long time in global health and the sustainable development goals that the WHO put out, several years ago, and sort of trying to understand why some countries do better than others. This has sort of been a personal interest, and that's when I got used to using World Bank and WHO data and discovering sort of the packages that were there in R for accessing those kinds of data. Going into pharma, there's more of an interest in what's called real-world evidence, which is basically everything that's not a clinical trial. So it's the publicly and some non-publicly available data that's from observational studies or from other kinds of studies that you want to leverage to try and figure out who you want to address and what are the problems that you need to solve. And then in work, I was dealing with questions about hospital utilization among Medicare recipients and got to work with the American Community Survey data, once again through our packages. For those of you who don't know, the American Community Survey, it is a survey that's annual, but it's run by the Census Bureau, and it is published every year in either 1, 3, or 5 year aggregates. And it covers sort of a subset of the questions that are asked on the census. So thinking about open data, there's plenty of things out there and there's plenty of ways of getting at it, right? So if it's on the web, we can always, web scrape. And there's great tools like HTTR and RVest within the R ecosystem that allow you to do that. I'm not going to talk about web scraping today. There's people who do it much better than I do. There's also just straight up availability of data sets on websites. So think of places like data.gov, where you can just download data sets after some searching and so on and so forth. And that's great. And most of the time you can get data sets in CSV format or Excel. I've actually seen data sets from MIT that are actually in our data format, which I got a little kick out of that they'd actually do that officially. And then The other form, and then hang on, I lost my place on my desktop. So just hang on. There we go. And then there's APIs, and APIs are fantastic, and they're actually more and more available. If you want to learn more directly about APIs and how they work in R, go back to last year's DCR and Mark's talk on APIs that he gave last year, which was a great introduction to how to use APIs through R. And there's video and slides and all of that available out in the internets. And then finally, of course, there's R packages. And of course, we're at an R conference. Ideally, we want to talk about R packages at the end of the day. So there's plenty of things out there to access data. So all that motivation, and then 2020 happens. And what that means is this, right? We're sort of in the middle of all of this. And I started way back in March to start accessing the Johns Hopkins data and start doing sort of these basic visualizations that sort of the Financial Times does as well, and the New York Times, but just to play around with how to grab data, how to do these kinds of visualizations, playing around with ggplot. I haven't done these for several months because there's professionals who are doing these kinds of things, and they're much better at it than I am. But it also got me really realizing the power of open data to aggregate all of these different disparate data sets into one place so that we can do these kinds of visualizations. Both the Hopkins people, as well as the New York Times, the COVID tracking project, which is an astonishing project because they, at least when I last went deeply into them, were doing things literally by hand, of aggregating these open data sources and putting them into one essential repository and sort of aligning things so that we can use it. And for the COVID world, the three of these four data sources have GitHub repos available for the data. And so we have the tools in R to just download these repos and access the data. And for the COVID tracking project, there's actually an API available which will give you either JSON or CSV files. And it's just a standard REST API that you could potentially access via HTTR, for example. So open data is great. And really, the COVID, the last 7 months, 8 months, whatever it is now, really showed us how much open data can be leveraged, which is fantastic. There's obviously a caveat with open data and open government data in that there's a great deal of variability in the completeness and the quality of the data. And there's other various problems in terms of ascertainment and how you call someone a patient, how you call something a death, a COVID-related death, and so on and so forth, which is absolutely not even around the world. And so data quality is still an issue, but the fact that you have access to at least reasonable amounts of data that are contemporaneous is fantastic. So for open data, this is actually from data.gov. They have a map. And open data has gotten, these are government sources, and it's pretty widespread, at least in the OECD countries, in India, China, Russia. Those are the countrywide ones. And then the markers there are actually city or state open data portals. So it's not just the national level data that's available, but also state and local data, which also is fantastic because it gives you some granularity. So in the federal government, is required to publish their data online with open standards under the Open Government Data Act of 2018. The biggest sort of catalog of this is data.gov. It has over 218,000 data sets. There's also a healthdata.gov, which is more interesting to me slightly. And it provides data from different agencies under the Department of Health and Human Services, as well as partner cities and states. And it's really focused on healthcare and allied subjects. So APIs in government data have become much more prevalent, which is a good thing. And there appears to be 3 general API infrastructures, if you will, that are in common use for open data if they're not actually having custom REST APIs available. So the 3 are the Socrata Open Data API, or SODA, CCAN, and DCAN. And true to government, there's no one API to rule them all. The CDC uses SODA. Datagov uses CCAN, as does the UK government. The European Union used to use CCAN, but now use a custom REST API. Healthdata.gov, which is, you would think, aligned to data.gov, uses DCAN. And then, just to put a spanner in the works, the FDA just did their own thing. So you need to know a bit of different APIs and API calls and digging in to get at different aspects of health data, even within the US federal system. More globally, the World Health Organization, which of course is looks at data and collects data from various countries around the world, provides not one but two APIs to its Global Health Observatory. One uses the Open Data API and the other uses the Athena API. And the World Bank, which everyone thinks of as an economics powerhouse, but they actually have great data on national health statistics, has its own API at api.worldbank.org. So we've got a bunch of APIs. Most of the APIs will give you JSON data. And so the basic tools are HTTR to grab the data and then JSON-Lite XML or other packages to parse the data. But I'm lazy and I love R. So I don't want to do all this hard work of figuring out the APIs and actually scraping them and putting the calls out and pulling them back. So what do? I look around for R packages to do this stuff. And so fortunately, the R ecosystem is fantastic because there are interested developers who have R packages that just have wrapped various APIs. So for the World Bank, there's actually two packages. WDI is a little older. WBStats is a little newer. Slightly different syntaxes, but fairly straightforward. You can basically put the indicators that you want. The World Bank indicators are very cryptic. And so it's worth like looking at the World Bank site to figure out what these indicators codes are. But once you have them, downloading the data is a one-line command, and then you can do what you will because this comes down to a data frame. The WHO also has an API. The R package, also called WHO, is not on CRAN, it's on GitHub. And it gives me a little more control because it allows me to download the actual codes, the indicator codes. And so once I have that, I can actually use R to do my searches and filters to figure out the codes I actually need to ask for to actually get the data that I'm interested in. So in this case, I'm showing you an example of getting life expectancy at birth for different countries over different years. The FDA, like I said, has its own API, and it does a bunch of data, makes a bunch of data available on drugs, devices, and food. What's actually often really interesting is that they have a lot of information about drug recalls or food recalls and adverse events. And these are things that are often really, really interesting to look at simply because it goes to the safety and whether I should, use a food or a drug. So there's a lot of data out there. It's a really big database. There is an open FDA package that uses that FDA API. It's very thin wrapper around it, so it's almost like piece by piece going through and just recreating the API call. I'm just showing you an easy example here where I'm looking at all the drugs in the FDA database and at what age patients got them. So this is almost patient level data, and you can see that we have, on the y-axis, we're going up to 150,000 count. So most drugs, obviously, in the US are, in the 40 to 80 age range, and of course, there's much fewer that are in the pediatric ranges. So I mentioned Socrata, CCAN, and DCAN. So all three have wrappers in R, which is cool. The R Socrata package is the one I'm highlighting simply because Socrata seems to be the most widely used across a lot of government databases. I'm just giving an example here for the CDC. I'm grabbing the number of COVID deaths in Maryland by week. I actually went to the CDC website and found out what the API call was. And so I can just get that API call, put it into Read Socrata, and I get a data frame that then I'm just using tidyverse to sort of filter it out for Maryland, and then showing a plot showing that we had our last really bad peak in, May, June, so early summer, but we're going uphill again as we go to the end of the year. And since it's 2020, there's plenty of COVID data packages. These were the early ones that I played with, which were COVID-19, coronavirus, tidy COVID. I'm sure there's more data packages that have mushroomed since then. Google will be your friend. And so I guess the overall point is that there is data that you can use from government sources that are available, that are easy to access from R, and allow you a great deal of power to do your own analyses and do your own sort of understanding of the underlying data for either your own benefit or your work's benefit. And you can do it all in R, which I think is the best part of this story. Not all the APIs out there have wrappers, so obviously there's work to be done by the community to help us out, lazy people like me, to make more packages so I can get them. So thank you very much for your time. And the slides are actually available on GitHub. There's a URL on GitHub pages for all these slides if you want to access them again. So thank you very much for your time and your attention.
Thank you very much. And that actually brings up a great point. We get this question is asked all the time. All of the talks will be posted online at rstats.ai within about a month. It takes a little bit of time. As I mentioned yesterday, we actually have a former Nickelodeon Double Dare NFL Films producer handling all of our video. It takes a little bit of time, but as soon as they're ready, usually about a month, because it's a lot of very high-res images, videos, and we'll post it up at rstats.ai. And at rstats.ai, you can find videos of all the talks from the past 6 years of conferences, both the New York conference and this government conference. So hop on over there to see videos. So just a few